Please subscribe and hit the bell icon so that you will never miss any video from Acuere Life Science Foundation. Myself, Dr. Shantanu R. Joshi, a clinician, a pharmacologist and a drug researcher. Dear students, today we are going to see the non-steroidal anti-inflammatory drugs, that is NSAID, popularly known as NSAIDs. First we will see their mechanism of action. Before going into the details of mechanism of action of NSAIDs, one must understand the arachidonic acid pathway. Dear students, do remember when the cell get injured by any stimuli, it may be physical, it may be chemical, it may be biological, it may be immunological, anything which is going to injure the cell. The cell membrane is made up of phospholipids, and those phospholipids will get converted into arachidonic acid by the enzyme phospholipase. Most of the time, the isoform of phospholipase A2, is used for the conversion of phospholipids into arachidonic acid. This arachidonic acid can further be converted into two different pathways. It can be converted to different metabolites by two different pathways. The important pathway is known as cyclooxygenase pathway, popularly known as COX pathway. When the arachidonic acid enters the COX pathway, it will give you three important inflammatory chemicals. Those are prostaglandins, different forms of prostaglandins, prostacyclins, and thromboxane A2, popularly known as TXA2. Dear students, do remember that in general inflammation, this pathway operates, and prostaglandins are the major mediators of general inflammation. This is the important thing which I told you about cyclooxygenase pathway. The arachidonic acid can be converted into different metabolites by lipooxygenase pathway, LOX pathway. The LOX pathway initially will give you 5-HPETE. It is known as 5-hydroxyperoxyecosacetonic acid. Further get converted into hydroxyecosacetonic acid, that is popularly known as 5-HETE. And 5-HETE is one metabolite, and another metabolite is leukotrienes, LTs. LTs are different forms of LTs are there, but popularly known as leukotrienes as a group. These leukotrienes are very important because all of you know asthma is due to this type of leukotrienes. In asthma, there is inflammation of the bronchus. In cyclooxygenase pathway, we have seen the general inflammation, that is the injury produced by some type of heat by physical object, or the bacterial infection, viral infection, or some immunological issues. That is general inflammation. But so far this asthma is concerned, the bronchial inflammation is related with a specific type of inflammation. The specific type of inflammation is due to leukotrienes. And all of you know, today to control asthma, to treat asthma, to prevent asthma, we use leukotriene antagonists like montelukast. Montelukast is a leukotriene antagonist, LT antagonist. Now, we know that arachidonic acid can be converted into by cyclooxygenase pathway into prostaglandin, prostacyclins and TXA2, or by lipooxygenase pathway into 5-HPETE and 5-HETE and leukotrienes. In this lipooxygenase pathway, LTs are there, and LTs are the major mediators of inflammation. Today, our focus will be on cyclooxygenase pathway. The cyclooxygenase enzyme itself present into two isoforms. popularly known as cyclooxygenase 1, known as COX-1, and cyclooxygenase 2, popularly known as COX-2. Yes, recently some work took place on the third isoform of cyclooxygenase, that is COX-3. The research studies are going on for COX-3. Today we will discuss COX-1 and COX-2. The COX-1 isoform is constitutionally present in the cell. What do you mean by constitutionally present? I mean constitutionally present means it is always present in the tissue cells. COX-1 isoenzyme is constitutionally present. It is always present. The another form is known as COX-2, that is cyclooxygenase isoform 2, which is inducible. It is not regularly present. But in case of inflammation, the production of this isoenzyme can be stimulated, can be induced. And that's why COX-2 is an inducible isoenzyme of cyclooxygenase. Dear students, you have to remember some important things about COX-1. COX-1 isoenzyme is constitutionally present and is having some physiological roles. One of the simple role I would like to tell you about COX-1 isoenzyme is production of mucus, production of bicarbonate ion in the mucosa of the stomach is a function of COX-1 isoenzyme. This COX-1 isoenzyme plays a physiological role and protects the stomach from the gastritis and also from the peptic ulcers. This is the physiological role of this COX-1 isoenzyme. COX-1 isoenzyme is also related with pain. COX-1 isoenzyme is also related with fever. COX-1 isoenzyme is also related with aggregation of platelets. And then hence the blocking of this COX-1 will give you analgesic effect, will give you antipyretic effect, and will give you anti-platelet aggregating effect. The COX-2 isoform is mainly concerned with inflammation. Blocking of COX-2 will produce anti-inflammatory effect. The conventional non-steroidal anti-inflammatory drugs, for example aspirin, ibuprofen, these drugs are effective for blocking COX-1 as well as COX-2 isoenzyme. And that's why these original old conventional non-steroidal anti-inflammatory drugs are anti-inflammatory, analgesic, antipyretic, antiplatelet. But these conventional NSAIDs are having the common side effect of gastritis, the nephrotoxicity is also related with it. All these are related with COX-1 pathway or COX-1 isoenzyme pathway. Now, there are some drugs in the market which preferentially inhibits COX-2 isoenzyme and are having less effect on COX-1. These are known as preferential COX-2 inhibitors. The best example of this preferential COX-2 inhibitor is meloxicam, nebumetone, etodolac. These are the drugs they preferentially block COX-2. They are having more effect on the COX-2 and less effect on COX-1. The COX-2 effect is 10 to 20 times more than COX-1 effect. And further research gave you selective COX-2 inhibitors. These selective COX-2 inhibitors are having more activity for COX-2 than COX-1, and this activity is 50 times, more than 50 times on COX-2 and less than 50 times in COX-1. These are known as selective COX-2 inhibitors. The suffix COXIB is used to denote these drugs. The best example is etarocoxib, then celecoxib. These coxibs are selective COX-2 inhibitors. They purely inhibit COX-2 and have a negligible effect on the COX-1. And the effect is that they do not have any gastric issues. Their side effect on the gastrus is equal to the effect of the placebo. Now we are having the three NSAIDs. One, conventional NSAIDs. They block COX-1 and COX-2. Then the second group of preferential COX-2 inhibitors. They affect COX-1 and COX-2 both, but the effect on COX-2 is more. And then the third group we are having selective COX-2 inhibitors. They act more on the COX-2 and very negligibly on the COX-1. Dear students, this is a very important chart related with arachidonic acid pathway. Dear students, all of you know that NSAIDs should not be used in the patients of asthma, especially aspirin should not be used in the patients of asthma. We call them aspirin sensitive asthma individuals. The same pathway will can explain the role of aspirin in induction of asthma. When we are using aspirin, it is going to block the cyclooxygenase pathway. Naturally, the more arachidonic acid will be available to get converted through lipooxygenase pathway, and there will be more production of LTs. When you block COX pathway, there is enhancement in the LOX pathway and will produce more LTs. Leukotrienes. Leukotrienes are the major mediators of asthma, and that's why you should cautiously use NSAIDs in the patients of asthma. Preferably, you should try to avoid the use of non-steroidal anti-inflammatory drugs in asthma. The same thing, the same pathway, the same chart is very useful to explain why corticosteroids are the strongest anti-inflammatory drugs of the world. Dear students, all of you know that the reaction starts with the conversion of phospholipids into arachidonic acid, and arachidonic acid will get converted by either cyclooxygenase pathway or by lipooxygenase pathway. Dear students, corticosteroids stops the conversion of phospholipids into arachidonic acid. When the conversion of phospholipid into arachidonic acid has blocked, there will be no conversion of arachidonic acid. There is no production of arachidonic acid, and ultimately there is blocking of cyclooxygenase pathway, that is general inflammation, and lipooxygenase pathway, that is a specific inflammation like in asthma. And that's why both the pathways will be blocked by the single type of drugs, and that is corticosteroid. Because corticosteroids block the conversion of phospholipid into arachidonic acid by blocking the enzyme phospholipase. Steroids block phospholipase, and that's why corticosteroids are the strongest anti-inflammatory drugs of this world. Thank you. Dear students, I know that you like my videos. Then please share and subscribe. Thank you.